Hi, my name is Brian Jose Locedeño Quijije, and I'm going to talk about personalized iPSC derived dopamine progenitor cells for Parkinson's disease. Definition: implantation of patient-derived midbrain dopaminergic progenitor cells differentiate in vitro from autologous-induced pluripotent stem cells in a patient with idiopathic Parkinson's disease. The patient-specific progenitor cells were produced under good manufacturing practice conditions and characterized as having the phenotypic properties of substantia nigra pars compacta neurons. Testing in a humanized mouse model involving peripheral blood mononuclear cells indicate an absence of immunogenicity to these cells. The cells were implanted into the putamen, left hemisphere followed by right hemisphere, 6 months apart, of a patient with Parkinson's disease without the need for immunosuppression. Positron emission topography with the use of fluorine 18L dihydroxyphenylalanine suggested graft survival. Clinical measures of symptoms of Parkinson's disease after surgery stabilized or improved at 18 to 24 months after implantation.
As a physician scientist here at Children's Hospital, I see lots of kids with a variety of both genetic and malignant conditions that affect the blood and the bone marrow. I see kids come in with sickle cell anemia. It's a very, very painful illness that's caused by a single abnormal base, a single point mutation out of the 3 billion pieces of genetic code in their cells. And yet that single abnormal molecule results in a tendency for their blood to become thick and sludge in their vessels and cause excruciating pain and a deterioration in organs over time, the heart, the lungs, the kidneys. That's a very devastating disease, and yet we can now study that in a petri dish. We can take sickle cells from a patient, put them into a petri dish, reprogram them, repair the sickle cell defect, and in a mouse model, we've actually been able to show that you can effect essentially a cure in that disease. But then there's dozens of others. There are various kinds of anemias and bone marrow failure, things called Fanconi's anemia, dyskeratosis congenita. A variety of these conditions are all now subject to the same basic platform, where we take the patient's cells, we reprogram them into stem cells in a petri dish, and then have a tool for research and a possible cell for therapy.
Issue applied in Ecuador. In Ecuador, there is not the treatment about personalized iPSC derived dopamine progenitor cells for Parkinson's disease. We barely use since 2013 deep brain stimulation for treatment, and it has been used with 18 patients.
It started out as my brother-in-law came over my house, and he saw me limping. He says, "Why, Joe, why are you limping?"
Parkinson's disease is typically diagnosed in males in their 50s and 60s. Joe Tentler was only 39 years old.
Typically, when a patient presents to the doctor, it's probably been going on for some time.
Dr. Wendy Bond says the first noticeable symptoms of Parkinson's disease are depression, fatigue, anxiety, and even some memory loss. But they're not usually recognized as being associated with Parkinson's disease until the patient develops tremors.
Tremors is the first thing that people notice, and it bothers them. Difficulty walking is huge also.
Dr. Bond says the symptoms are unilateral, often causing stiffness on one side of the body first.
I went to my right side, and I had stiffness and tremors, and then it went down the road to my left side. My arm locks up, My hand locks up. You can't move my fingers.
As the disease progresses, patients can develop a change in their facial appearance and have trouble with their handwriting.
Well, Parkinson's disease itself is caused by loss of dopamine within the brain. And when you have a reduce or a loss of the dopamine, it produces motor symptoms, typically difficulty walking. You have a gait instability, rigidity, either on the right side or the left side. And it also produces a resting tremor.
While the cause is unknown, Dr. Bond says genetic testing can be done to determine if someone has early onset Parkinson's. For Lee Memorial Health System, I'm Lindsay Fry.
And can I get him down and walk?
Yeah, sure. Do what you need to do.
Applications in medicine. The improvements in motor assessment and patient-rated symptoms scales in our patients should be interpreted with caution, because both he and the raters were aware of the intervention and there were no control comparisons. Clinical change appeared gradually during the 18 to 24 months after implantation, a time frame consistent with gradual reinnervation of the putamen by projections from dopaminergic neurons. During this time, the levodopa equivalent daily dose decreased by 6%, a reduction of uncertain clinical importance.
My name is David Smith. I'm undergoing an evaluation for DBS for treatment of Parkinson's.
Open and close.
David had probably the worst tremor I've ever seen from Parkinson's disease. It's very high amplitude tremor and with high frequency. He was a very normal, nice guy. Couldn't stop shaking, completely wet with sweat the first time I saw him walk into the clinic.
I've had Parkinson's for about 11 and a half years. I said, there will be a cure someday, but this is my cure for now.
Pros and cons. It is uncertain whether the immune system in the central nervous system will react differently to iPSC derived autologous as compared with allogenic MDAPS. One goal of autologous cell therapy is to avoid the requirement for an indeterminate period of immunosuppression inherent in the use of non-autologous tissue. No immunosuppression was used in the course of this patient's treatment, given the hypothesis that the autologous source of the original fibroblast will yield an implantable cell product recognized as self. The graft survival experiment in autologous as compared with allogenic humanized mice report here support this hypothesis. An autologous cell approach is costlier and more labor-intense than the use of generally available, pre-characterized allogenic cell lines require production and safety testing for each use.
This is Marta and Dana, and they're hard at work today making neurons, dopamine neurons, from people with Parkinson's stem cell lines.
Conclusion. We report the production and implantation of iPSC derived autologic dopaminergic progenitor cells in a patient with Parkinson's disease, with clinical and imaging results suggesting possible benefit over a period of 24 months. Further studies are warranted to address how this approach will perform in a variety of patients with diverse genetic backgrounds and disease phenotypes over a period longer than 24 months.
Who works with us at APDC. She's looking at different experiments that we've been doing, looking at different drugs that we think might be helpful in Parkinson's. She's looking at how different cells have responded and counting how many are in the experiment after the treatment of different drugs. And we're hoping that we can find some possible targets that will help with Parkinson's in the future.
Thanks.